The coronavirus pandemic has undoubtedly had one of the greatest impacts on the world for a generation. Ever since that fateful day where a member of the Chinese general public decided that for lunch they would forego a packet of crisps and a poorly constructed cheese sandwich in favour of a trip down to the local market in Wuhan where this whole sorry mess allegedly originated, coronavirus has dominated world headlines with the reach that any celebrity would sell their soul for. Since the initial outbreak in December of 2019, scientists around the world have scurried and sleuthed in order to better understand the scale of the problem, comparing it to the SARS outbreak and the Spanish flu, amongst others. This wasn't merely a matter of scientific curiosity, though. The virus spread far and wide through developed nations, notably Italy, Spain, the United Kingdom, and the United States, whose governments wanted to know what should be done. Could the virus be treated with a vaccine? Could antibody cells be detected as a kind of proof of immunity? Could wearing a face mask really make a difference? Governments across the globe have all adopted varying strategies to combat the virus based on the data they have had available. The worst affected areas instigated lockdowns, curfews, and imposed regulations that closed businesses and generally just limited person-to-person contact. But not everyone was on board with this kind of COVID panic, with many people drawing attention to statistics on seasonal influenza, that's the flu to you and me. They were curious as to whether this disease was as deadly or as virulent as the pundits were saying. Governments too, looking at the data provided by scientists and the looming recession that nationwide lockdowns would incur, also wanted to know the answer. So, in testimony before the US Congress on March 11, 2020, members of the House Oversight and Reform Committee were informed that estimated mortality for the novel coronavirus, or COVID-19, was approximately 10 times higher than for the seasonal flu. Additional evidence from researchers at Waterloo University in Canada for the Disaster Medicine and Public Health Preparedness Journal, that's presented by the Cambridge Coronavirus Collection, seems to suggest otherwise, however. This is important because this congressional hearing in particular guided all of the coronavirus response measures that were yet to come. We'll get to their contribution in a moment, but let's start at the beginning. On March the 11th, 2020, the US Congress House Oversight and Reform Committee received institute from the National Institute of Allergy and Infectious Diseases, or NIAID for short, concerning the novel coronavirus, secure acute respiratory syndrome coronavirus 2, or SARS-CoV-2, and coronavirus disease 2019, COVID-19. Based on the data available at the time, Congress was informed that the estimated mortality rate for the coronavirus was 10 times higher than for seasonal influenza, which helped launch a campaign of social distancing, organisational and business lockdowns, and shelter-in-place orders. Previous to the congressional hearing, a less severe estimation of COVID mortality appeared in a February 28, 2020 editorial released in conjunction by NIAID and the Centers for Disease Control and Prevention, or the CDC. Published online in the New England Journal of Medicine, this editorial stated, "The overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe flu, seasonal influenza, which has a case fatality rate of approximately 0.1%. Before we go any further, it is vitally important that we address this statement in particular, because it lays the groundwork for the misinformation to come. Epidemiologists distinguish between two types of data when describing deaths during and after a disease outbreak: case fatality rates, or CFRs, and infection fatality rates, or IFRs. CFRs indicate the disease's severity, whilst an IFR is defined as the proportion of deaths relative to the prevalence of infections within a population. In lay terms, the case fatality rate is the observed data, the observed number of deaths counted from confirmed cases of the disease, whereas the infection fatality rate is an estimate of how many potential deaths might occur in a population. Because these different types of fatality rates can vary wildly, it is imperative not to confuse them with one another, else misleading calculations with significant consequences could result. Interestingly, a search term of the keyword infection fatality rate on the CDC website returns no matching results, nor is the epidemiological term located in the CDC's 511-page publication, Principles of Epidemiology in Public Health Practice. This terminology omission, in conjunction with the questionable use of the terminology in the New England Journal of Medicine editorial, raises a red flag warning of possible inaccuracies in the mortality estimation for coronavirus that was presented to Congress. If you'll remember, the statement given was that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, with a case fatality rate of approximately 0.1%. So the committee learned that the mortality from seasonal influenza is 0.1%, and it was additionally reported that the overall coronavirus mortality, which had been at 2 to 3%, had been reduced to 1% to take into account infected people who are asymptomatic or have mild symptoms. The adjusted mortality rate from coronavirus of 1% was then compared with the 0.1% case fatality rate from seasonal influenza, and the conclusion was reported to the House committee that the coronavirus was 10 times more lethal than seasonal flu. Herein lies the problem, of course, because the adjusted mortality rate for coronavirus is an estimate more akin to an IFR than a CFR. The IFR for seasonal flu is around 1%, which sounds a lot more like the 1% adjusted mortality rate for coronavirus. Unfortunately, there will be no way to really predict the true IFR for coronavirus until the first outbreak is complete, and scientists can analyse all of the data to make a future estimate for another outbreak. In addition, better testing and an accurate measure for infection needs to be developed, as well as an understanding of both susceptibility and the long-term effects of the virus as well. It doesn't help that most governments are recording their numbers differently, and there have been raised questions over so-called deaths with coronavirus being incorrectly recorded, as opposed to deaths from coronavirus. Hopefully this video provided you with some useful information, and if it did, please hit that subscribe button. Like the video, do let me know if you enjoyed this format, or if there are any other topics you'd like for me to cover in the comments below. I have been Not So Obvious. Have a great week.